Go ahead and start. So good afternoon, everyone. We appreciate so many of you spending your lunch hour with us today. My name is Dave Newell, and I'm the President and CEO of Children's Home Society of Washington, and I'll be serving as the moderator for today's panel. During this webinar, we are going to share with you more details about the new state legislation that defines a family resource center, as well as our efforts to develop a statewide family support network in Washington state. We have a great lineup of speakers that include Sharonda Selovanov, who serves as the public policy. Oh, I just lost something here. Hold on. Just a second. Who serves as the Public Policy Director for Children's Home Society of Washington. Sharonda will share more details about the recent legislation and why this legislation was a critical step in lifting up the work of family resource centers. Our second panelist is Byron Mannering, who serves as the Executive Director of Bridget Collins Family Support Center. Byron will share his history operating family resource centers, why he supports the recent legislation, and our efforts to develop a statewide family support network. Our final panelist is Andrew Russo, who serves as the director and co-founder of the National Family Support Network. Andrew will share background on this national movement and recognizing the benefits and importance of family resource centers and what has been happening in other states with family support networks. First, I would like to introduce to you our host for today, Representative Carolyn Eslick. Representative Eslick sponsored House Bill 1237, which defines a family resource center and has been a longtime supporter of family resource centers in our state. We appreciate Representative Eslick taking the time to be with us today, and I will hand it over to her to share more. Representative Eslick?
Thank you, Dave. I'm pleased to be here today and excited about telling our story. First, I want to give you a little history of my life and involvement in family support centers. In my previous life, I owned a restaurant for 20 years. During that time, I had about 40 employees, and I was forever in my office counseling somebody about something. And one afternoon in 1992, the phone rang, and it happened to be the Snohomish County Human Services. And they asked me if I was interested in my community to have a family resource center. And I said, never hearing those words before, I said, what does that mean? And she said, it means that it's a place for your community to go to get help. And I said, well, you know, this is the perfect time because in my office today is a cook that is a single mom with 5 children, and she's tried to commit suicide for the 3rd time. I need help in my community. And so then I said to them, what can I do to make this happen? And she said, you need to call a public meeting. So that afternoon, I called 40 of my leadership folks in the community and the timber companies, because this money was federal money for timber devastated communities. So we had that meeting and everyone showed up that I called. They got the information of what a family resource center was, and they were ecstatic. Well, the facts were there was another community in our state that was also looking for that money. And so I was required again to have another meeting. Ended up that we were the first one in our county to have a family resource center, opened that later year in 1992. Since then, it has been going strong, and it is an amazing place for all community members to do everything that they need as far as family support and family building. When I was appointed as a state representative in 2017, I went down to Olympia thinking that it was not going to be a problem whatsoever to set up family resource centers statewide. Well, I found all kinds of roadblocks, including they didn't know what family resource centers were. So now I'm in the process of educating all my colleagues of what that is. Well, I reached out to my local Volunteers of America, who was our facilitator for our family resource centers, and they too were behind this 100%. And they developed their own certification for our county-wide family resource centers. But that wasn't enough. It wasn't the engine to make the whole statewide happen with the Family Resource Centers. Well, then I was connected to the great people at the Children's Home Society and met with Dave and Sharonda and Janica and found out that they were doing the same thing. So we combined our efforts and we managed to pull together many folks that were involved in Family Resource Centers, whether they were the director or employees, what they've been involved in it. So we then found out through that process about the National Network for Family Resource Centers that was just developed in 2013. We also found out there were 60 Family Resource Centers that identified themselves as Family Resource Centers. So we managed to pull together the definition, and we managed to this last year pass it unanimously in the House, and then went over to the Senate side. And finally, people understand what Family Resource Centers are at our local government level. And I'm thrilled to be able to be part of this today because it is a national movement. It is our the future for our kids lie in our combining and our resources and our reaching out to our community through our Family Resource Centers. So thank you again for allowing me to tell the story. I'm thrilled to be part of it. It actually makes me humble and actually brings tears to my eyes that we're doing this. Thank you.
Thank you so much, Representative Eslick, for your leadership and commitment for Family Resource Centers over the years in Washington State. It's been a delight to work with you and on this legislative session and see the passion that you have for this work. Our first panelist today is Sharonda Sullivanov, who serves as the Public Policy Director for Children's Home Society of Washington. Sharonda is going to share with us more details about this legislation that defines a Family Resource Center in Washington State and what this legislation means for Family Resource Centers. Sharonda?
Thank you so much, Dave. And once again, I want to just echo the sentiments to Representative Eslick. You are a trailblazer, a change agent, and my champion. And we are so excited to have partnered with you in moving this legislation forward. As Representative Eslick has already shared, it was passed unanimously, as she has shared the importance. I'm going to share with you the pieces of legislation. And I'm also going to share with you some of the vision and why this is so important for our communities. The Act itself is intended to provide a common definition of Family Resource Centers across the state of Washington. And there's going to be a set of guiding principles that are in the legislation centered around families, equality, respect, supporting cultural, racial, and linguistic identities, and mobilization of formal and informal resources. Services that are unique to this legislation are referral services and family navigator advocate. I want to just pause there, and I wanted to share a very short story. Recently, I was approached by a youth, and this youth needed help. And I have to tell you, he had a broad range of supports that he needed. And if I could tell you how many different places I had to search out to get this youth to the help, it was really laborious on my part. And without, my ability to kind of do some resource navigation, I don't know if him and I would have been successful. So what I can really speak to is the importance of having someone knowledgeable who really understands the resources and can get you to your next indicated place. We really want to help people to get to the help that they need and not make it a full-time job to actually access the resources that are housed within their community. So that is some of the thinking that is behind the Family Navigator and really having a comprehensive array of referral services housed in one location. FRCs play a critical role actually in preventing child abuse and neglect, connecting families to agencies and programs, and supporting community level coordinations to resources and support services. Neighborhoods with FRCs actually have a 26% lower rate of child abuse and neglect investigations than those similar neighborhoods without them. So what we know is that when people can get to the resources that they need, we are seeing children not experiencing harm. FRCs will recenter and refocus, being responsive to the needs of the community that they serve so that they don't have to get to a severe level of crisis, and that we have a pathway and prevention in many areas supporting many areas and the development of children. I want to just emphasize that 43% of families that enter child welfare are there to actually poverty-related issues that do not have anything to do with with abuse. We also know that 78% of the calls that are made to CPS intake line do not meet the threshold for child welfare intervention. We also know that the likelihood of these families needing some type of support is really quite evident. We need a centralized response outside of CPS intervention, and we certainly do not want families to have to reach a state of crisis to unlock funding to support that they can receive through child welfare. So building on the local, state, and national momentum for the need for family well-being, FRCs will provide those referrals and supports to every member of a child's family. Concepts of care should be defined and supported by families within the communities in which they reside. FRCs are a vital service to our communities, and there is a need for expansion. Ideally, they will house many supportive services with the staff comprised that are extremely knowledgeable. And lastly, I just want to say, in reimagining a care for children, youth, and adults, what we want to do is have a robust community infrastructure. I like to say that we want to be able to be community responsive in a way that answers those needs of those families. In reimagining, we really want to be able to equip our mandated reporters into being mandated supporters. We want our citizens, our teacher, our mental health providers, our coaches, daycare providers, substance abuse counselors, a whole wide range of people that when they encounter people that are having some needs, that they know where to call, and it doesn't have to be to the CPS system. So let us build us a strong community where we actually support families in a way that when they need help, they can ask for help, they will receive the help that they need. It will be provided and responded with compassion and care with a person who's extremely knowledgeable on how to help that family, not just survive, but actually to thrive. Thank you so much, Dave.
Thank you, Sharonda. If you'd like to read the final language of the legislation, it's already in a link in the chat box to the side. Our second panelist today is Byron Mannering, who serves as the Executive Director of Bridget Collins Family Support Center. Byron is a longtime leader of family resource centers in Whatcom and Skagit counties. Byron will be sharing his thoughts on why he supported this legislation that defines a family resource center and our efforts to create a family support network in Washington State. Byron?
Well, thank you, Dave, and good afternoon to everyone. It's good to be here with you all. And I echo the sentiments towards Representative Eslick. Thank you for your stalwart leadership through this process so far. And I'm really anxious and looking forward to next session when we can do a little bit more work on this. And my gratitude and commitment to the fellow committee members who've been working so hard on this. And just great to be here also with Sharonda and Andrew and Dave presenting to you as well. I've been asked to talk about what it's like to run Family Resource Center and how it impacts families and why setting up a statewide Family Resource Center network is so important now that we have legislation in place. Of course, every center is unique, and I want to recognize all the great centers across the state who have pioneered this service in their communities. It's a labor of passion for everybody I know, but also a labor of doing the right thing for our families. For me, running a family resource center really is most importantly about embracing family support principles and standards in all of our activities, and to continuously and systematically work to improve on the delivery of those activities and standards. And, you know, so many of our families are isolated, you know, they're without relatives or friends that they can count on, and they don't have a sense of community connection, and they're alone in their struggles and confused and oftentimes let down and judged, and sometimes even harmed by the very system that we've put in place to help them. You know, these are the families that Family Resource Centers look to build a supportive relationship with before things get worse, before they get bad. In other words, it's prevention. And as many of you will agree, there's been a lot of talk about the importance of prevention, but very little resources actually dedicated to it. So we in Washington State, I think right now have an opportunity to solidify our statewide commitment to prevention and to champion what we absolutely know to be true, that prevention works. And we need this Family Resource Center network to help make that happen. So what does a Family Resource Center look like? They have some commonalities. Janica has agreed to help me out with some slides here. So okie dokie, Janica, if you could put on the first slide for me. Family Resource Centers are place-based. They're facilities that families can come to connect with others and to get the support and services they need when they need it. We started out at Bridget Collins with a very inadequate 1,200 square foot office space that had no room for families to come into our office. We did all services out in the community. So we really were not a family resource center. And then we moved into a larger office and started doing business as Bridget Collins Family Support Center and implementing the family support practices and standards. You know, it was a big step to move into a larger facility. And I really did wonder if we could actually make it a place that families would want to voluntarily come to and engage in. And it took a while, but I remember the first family I saw coming in and feeling really just so grateful for them and grateful for all the families who followed them. With this sense of place and space, our family advocates are available for them at that location. We have family advocates on call, so people that drop in can get help right away. We have family activity nights, parent groups and classes, and just really kind of a menu of services that we provide. So if you do the next slide, Janica, this is the Whatcom County offices that we have. And then the next slide after that is our Mount Vernon offices. Today we have family resource centers in both Whatcom and Skagit counties. Now, these spaces were not possible without a combination of both public and private funding. So if you're out there and you've been supportive of family resource centers with funding in some way or another, thank you very much. We really can't do it without you. Okay, next slide is slide 4. Family resource centers provide information, resources, and referrals like Sharonda was talking about. And I want to indicate that this is not a passive service. It's not easy for families to ask for help. So, you know, we feel that being exceptional at that first contact is really essential because you don't always get a second chance. A couple of years ago, a father dropped in with his 4-year-old daughter, and he said the girl's mom was just sent to prison, and he'd never taken care of her before or any other child before. And he said that he had anger management problems, and he just wanted to make sure that that didn't impact the way he was parenting his daughter in a negative way. And one of his friends said, you know, hey, you know, go to this place, go to Bridget Collins, and you can get some good help there. And so he did, and he came in and asked, and sure enough, we were there to start getting him linked up with other services and providing services for them. And his family accessed our services for the next couple of years. The next slide, please. Family advocates are the cornerstone of family resource centers. And I think engagement with the family is their really most essential responsibility. However, they do help families plan and navigate this system of services that is confusing and difficult. And it's a lifesaver for many families. We had one mom who showed me 2 pages worth of business cards and sticky notes of names and numbers that she finally photocopied all on these 2 pieces of paper. And they were all the service providers that she had to make appointments with and stay in contact in order for her to keep her children at home and from being taken and put into foster care. Her family advocate just helped her with that over a year and navigating that system, making sure that all that was working for her and supporting her and getting that done. And then the system was finally satisfied and closed her case. I don't know that she would have gotten that help anywhere else. Next slide. You know, families know best about what they need. And so family resource centers do our best to help them get what they need when they need it, which means our family advocate really has to partner with the family. Example, 3 years ago, mom dropped into Bridget Collins and her son was placed out of town in foster care because of domestic violence and substance abuse and neglect. And one of our family advocates, Susie, met with her and right then and there when she came in and found out the mom wanted to get out of her unhealthy relationship. She wanted to get clean. She wanted to get a job and she wanted to have her child returned home, and she needed help. And so I'm happy to say 3 years later, mom did it with Susie, her family advocate, by her side. She did all those things, and now she's ready to be on her own. And I don't think that might have happened without the support of her family advocate and the Family Resource Center. The staff who work at Family Resource Centers are incredible, and Susie has been an advocate for our families at Bridget Collins since 2001. And she really exemplifies what Family Resource Centers are all about in my mind. She has a passion for the principles of family support, and she also has the love for music. And so she wrote these words. So this is the last slide, Janica, if you wouldn't mind putting that on. So she wrote these lyrics and I'd like to share them with you. Hey, hey, I know a cool place I can go that helps me and my family. The people there, they truly care about my joy, pain, or woe. They don't let me go out alone. Yeah, they walk by my side, support, coach, and guide. Bridget Collins family. So home away from home, helping me to carry on in times of stress, times of fear. Bridget Collins' house is near, lifts me up, gives me hope, teaches skills to help me cope. Bridget Collins family. Hey, hey, you know a safe place you can go, helping you and your family too. This place has got some magic heart, caring for our families, creating hope in our community. Yeah, we walk by your side, support, coach, and guide. So home away from home, helping you to carry on. Times of stress, times of fear, Bridget Collins' house is near. Lifts you up, gives you hope, teaches skills to help you cope. Bridget Collins family. So Susie that's the end of the slideshow, Janica, so you can stop sharing now. Susie's retiring at the end of the month after 20 years at Bridget Collins, helping families carry on. And I just want to say thank you, Susie. I know you're out there for the family support legacy you leave us, and to all the family advocates across the state who are doing such great work in their community and for their families. I really appreciate you all being here today and listening. And I really hope that you might consider doing what you can to support the creation of a statewide network and helping make it possible for all families across the state to have a family resource center in their community. So thanks again for joining us. That's what I have to present. Back to you, Dave.
Thank you so much, Byron. It is great to hear why someone who has had a long history of operating and managing a family resource center supports these efforts. Next up, we have Andrew Russo, who serves as the director and co-founder of the National Family Support Network. We appreciate Andrew joining us from Washington, D.C. today. Andrew also has a long history of working for and with family resource centers, and we congratulate the National Family Support Network on celebrating its 10th anniversary this year. Andrew will be sharing more about this national movement and what is happening with other family support networks that exist around the country. Andrew?
Thank you so much, Dave. Well, hello from the other Washington. So glad to be with you today. It's so exciting to see the wonderful work you're doing and the leadership that is coming together with Representative Eslick's work, with the work of the Children's Home Society, and with FRC directors such as Byron, looking to move the needle forward for children and families in Washington State. So really excited to be here and part of this session today. Next slide, please. So want to give you some context to talk about family resource centers, first flagging that they have a long history that goes back to the turn of the last century when immigrants were coming to this country in large numbers, primarily from Europe. And these settlement houses, like the image you see on the left in San Francisco, sprung up in major metropolitan areas to support those new immigrants to succeed, including in Seattle has a settlement house history as well. And on the right, you see the same location, San Francisco today, which is now a family resource center. So the roots of this work go back more than 100 years. And some of the supports and services FRCs provide today are exactly the same as more than 100 years ago, such as English classes and job skills training, but also many other supports and services that we now know support families to succeed, with a particular focus on children's healthy development. Next slide, please. Family resource centers have emerged organically across the country, yet their work is largely under the radar. So we refer to them as America's best kept secret. They are welcoming hubs of support that strengthen families to succeed. They may be community-based, like the image you see on the left from Vermont, or they may be school-based, like the image you see on the right from Kentucky. Next slide, please. Family resource centers work with families with an approach that is multi-generational, strengths-based, and family-centered. Each of those concepts is important. So you may have heard of two-generational work or two-gen work. Family resource centers are the original multi-gen work, working with both children, their parents, and also grandparents and other caregivers and supports of the child's healthy development. They're strengths-based, recognizing that families come to the table with strengths and resources that we want to support them to build upon and further developed. And everything we do is family-centered. They're designed for all families, and that concept is really important. So they're not only for low-income families or highly challenged families. That makes a big difference in terms of their supports and services being non-stigmatized, because it's a place everyone can access support. The image on the right comes from New Jersey. New Jersey has 21 counties and 57 family success centers. That's what they call family resource centers there. That includes very affluent counties as well as highly challenged counties as well. Every county has at least one, and typically more than one, family success center, because the belief is all families should be able to access supports to support us with two of the most important roles we can have as adults, being parents, being spouses or partners. Two of the most important roles that we can have that we actually receive next to no training or support for whatsoever. Family resource centers are here to help. They provide services that are at no cost or low cost for participants, and they support families to build protective factors that support their healthy development. Next slide, please. The Strengthening Families protective factors are some of those protective factors that FRCs help build. You can find much more information about these on the Center for the Study of Social Policy's website. These are research-based, evidence-informed factors that we know support families to be healthy and strong and ensure they're less likely to end up experiencing child abuse and neglect. So as long as we're going to be working with families, we want to be supporting them to build these 5 protective factors. And that's exactly the everyday work of FRCs. Next slide, please. Family resource centers, and click on it again, have no dedicated federal funding. So they're unlike Head Start programs or home visiting programs, all of which have dedicated federal funding. And yet there are more than 3,000 of them nationwide. Click again, that serve more than 2 million people annually. Next slide. So how could that be? How could it be that there are so many of these family resource centers without dedicated federal funding? Why are so many states, counties, and municipalities choosing to invest in these centers when nobody's telling them they have to? And the answer, simply put, is that FRCs are a good idea. They're cost effective, they're not high cost programs, and they yield wonderful results. They're highly adaptable, so they can work with urban families, rural families, LGBTQ families, immigrant families, Native American families, all kinds of families. And they have a track record of successful outcomes demonstrated through multiple external evaluations. We'll be sharing some of that data today. Thank you. FRCs have stepped up immeasurably in response to supporting families with COVID. So two of the things that families have most been looking for are parenting support, particularly parental stress support, and access to resources. And it so happens that those are the bread and butter services of any FRC, which the images on this slide reflect how FRCs more than rolled up their sleeves, redoubled, retripled their work to help support families with and through the pandemic. Next slide, please. And as a result, we've seen major new investments in FRCs across the country from states red and blue. And this is a particularly remarkable development for this field, which has been so under the radar, is now starting to pop up from under the radar as states have recognized that FRCs are extremely valuable, not just in times of crisis, but always. And so we've seen states here listed making extraordinary investments in strengthening the existing FRCs, expanding, adding new FRCs. Next slide, please. This slide was developed in conjunction with the Casey Family Programs, also based in Washington State, which is one of the national partners of the National Family Support Network. And what this slide illustrates is the continuum of a family's potential involvement in the child welfare system and how the FRC works with supporting that family. So first column there is primary prevention, which is what FRCs are most known for, supporting families to be healthy and strong upfront and never entering the child welfare system. Next column is differential response. That's when a call comes into the child abuse hotline and the workers decide that it doesn't rise to the level where they're going to open a case, but they could tell that that family could use some support. So they refer them voluntarily to an FRC for services. And we'll talk more about the results of that in just a moment. Then also next column is open child welfare case. So when there is an open case, how does the FRC work in conjunction with child welfare to support that family? So one example of that is parenting education. So let's say a family is mandated to have parenting education. Where do you send that family for that parenting class? You send them to the FRC, which is already providing parenting education, typically using an evidence-based curriculum. And the beauty of that is as the family participates in that class, they're there with other families who are there voluntarily. So it's non-stigmatized. And unless they disclose, nobody knows whether they're there voluntarily or because they're required to be there. And next slide, please. And so one level up, now that we've talked about FRCs, are family support and strengthening networks. So not only have so many states invested in FRCs, but they hit upon the value of networking the FRCs together, just like you're looking at doing in Washington State. And that creates a wonderful opportunity to leverage them for more effective support of families within a geographic area. Next slide, please. Most common functions of FRCs are the following: increasing connectedness, coordination, cooperation, and collaboration amongst members, the 4 Cs, providing training and technical assistance. That's a very common activity of networks to get everyone on the same page about quality work with families, addressing systemic issues that no one center could on their own through advocacy, systems change, policy, legislation, and maintaining and providing a shared data tracking system so you can see what's going on with supporting families across an area. Next slide. And this slide illustrates different stages of network development that start from when you're just getting started, which is where Washington State is now, to further established networks. And also that there are different types of networks, ones that are coordinated by volunteers, ones that are coordinated by funders, and ones that are independent nonprofits. So there's great variety in the kinds of networks that we see out there. Next slide. This map illustrates the original membership of the National Family Support Network. When we were just getting started 10 years ago, there were 8 states that, again, had networked FRCs together, and they came to the table to co-found this national network. And if you click to the next slide, you'll see what the map looks like today, where we have more than quadrupled in size to now 34 member networks, 33 states and the District of Columbia, representing more than 3,000 FRCs that serve more than 2 million people annually. Washington State has actually been colored in green on this map for some time because there is an existing network of FRCs in Seattle, and they have been involved in the national network for several years now, and we're delighted to pass the torch over to the newly emerging statewide network in as well. Next slide. The mission of the National Family Support Network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of those statewide networks and championing quality family support practices and policies. And our vision, simply put, is that that whole map would be green, that all families would be able to access quality family support services in their communities through FRCs that are supported by strong networks, that we wouldn't think twice about there being an FRC in our neighborhood, just like there should be a good school and a park and a library, just building blocks of healthy communities and societies. Next slide, please. Areas of work of the National Network include connecting those networks to each other. They can pair, share, and learn from each other. 2 is promoting family support best practice. That's where work comes in with nationally adopted standards that I'll talk about in a second. And 3 is raising the visibility of the work of FRCs and FRC networks. Next slide. And these nationally adopted standards that I referenced are designed to be used by all stakeholders, foundations, public departments, and communities, community-based organizations, and families themselves as a tool for planning, providing, and assessing quality practice. I've seen there were a number of questions related to the role of participants, the role of families in centers and centers development and advising the centers on their work. That is squarely in the standards. That's really important part of how we talk about quality work, is that it's of, by, and for the community served. And the standards show us how that we can make that happen. The standards also integrate the principles of family support practice that Byron referenced earlier, as well as those strengthening families protective factors that I mentioned before. Next slide. And they create a common language across different types of family support programs, including family resource centers, as well as any program working with families we would say would find value in using the standards. So the standards can be particularly helpful in Washington State, where you're just getting folks together, defining what an FRC is. The standards can help you go further with now starting to talk about what does quality work look like across those diverse centers that have, again, emerged organically in lots of different ways. The standards and all the implementation tools are available for free on the National Network website. So we're not selling the standards. We want everyone to have access to and think about quality work with families. Next slide. And the standards were recently revised, working with parent leaders across the country, the members of the National Network, and actually representatives from Canada as well, with a particularly eye on enhancing the focus on diversity, equity, inclusion, which is not only a section of the standards, but is infused throughout the standards as well. So really important to think about how we can support communities to develop in equitable ways, and the things that we need to pay attention to, not only working with families, but with systems change efforts to ensure we move to a more just, equitable, and fair society. Next slide. This slide illustrates where the training on the standards has happened. We have a certification training, and as you'll see, it hasn't come to Washington State yet, but Seattle plans to host a training in the fall, which we're very excited about, that we'll be able to color in Washington State on this map as well. Again, getting us all together on the same page about quality work with families. Next slide. And this is the contact information for the National Network. Should you be interested in more information. There's tons of information about FRCs on our website, a whole page that includes research reports and data about FRCs you can find there as well. Thank you.
Thank you, Andrew. We appreciate you sharing your insights and knowledge of family support networks around the country, and we look forward to working with the National Family Support Network as we develop a network in Washington State. And I notice there's a lot of questions in the chat box that hopefully we'll get some time for the panelists. I appreciate all of our panelists for joining us today, and Representative Eslick for hosting this great event. Before we move to the Q&A in the chat box, we wanted to give you an overview of next steps. First, we are hoping to launch a stakeholder engagement process in the fall with family resource centers and other stakeholders to create a vision for a Washington Family Support Network. If you're interested in being a part of these conversations, we will be following up in the coming months via email, your email address that you registered with for today's event. If you want to learn more about the national efforts and about family support networks, you can visit nationalfamilysupportnetwork.org. If you have further questions, we are also providing email addresses on the screen. If you have some questions in the chat box, we'll spend the last few minutes answering a few, knowing that we are just at the beginning of this journey in developing a family support network in Washington State. And at this point, I think we're going to turn it over to Janica for some questions.
Yes, so Hubin's been tracking the questions for me. Hubin, are you there?
Yes, I'm here. I have some questions from the chat box that I've listed and also from the Q&A. Where should we start first?
Let's do the Q&A first.
Okay, so the very first question is, can you share how many community members are actively participating in creating and or sustaining the model? And are they a part of the ongoing maintenance of the program?
I think the person's alluding to who's involved in the development of the statewide web network right now. And so I can speak to when we submitted our application to the National Family Support Network, we have about 46 organizations being represented now, with the city of Seattle supporting 22 family support organizations, and Pierce County Public Health supporting 7, and then Children's Home Society has 8 family resource centers, and then we have the family support centers that Byron operates and other FRCs around the state of Washington. So we're up to 46 right now, and the hope is through, as Dave mentioned, the stakeholder engagement process, we'll be adding more throughout the state. And I hope that answers that person's question.
Thank you, Janica. So the next question that we have here is, what is the value of FRCs to hire those with lived experiences or even those they have served?
Sharonda, were you going to take that one, or Representative Eslick?
Looks like we both have our finger up. Of course, those that are inside of the communities closest to proximity of what is happening for them or the families that they serve is of great importance. There are many opportunities for lived experience to help shape all of this as we, continue to develop what FRCs look like here in the state of Washington. So we encourage that, and we want as many voices representative as we continue to build this together here in Washington. So absolutely, lived experience at the table as we put this together.
So can you hear me? Am I on? Okay. So I know for a fact, since I've been involved in ours since the early 90s, that the folks that are the users, many of them stay around to be on the advisory team. Many of them have been hired at different levels throughout the years. And currently we have 2 sisters that have lived that life. And just 2 years ago, we had a local person actually be our director. And because her turnaround in her life and because of her college degree has got a very high position in another organization. So it is just umbrella and encompasses and supports all levels of our families. And we love to have the success stories be part of the story and continuing use and participation in our family resource centers.
Thank you so much. I'll move on to the following question, which is, are you able to share whether equity and social justice has been integrated into the structure and maintenance of the programs? If so, can you share an example of steps taken to be mindful of ESG?
I'm going to turn this actually over to Andrew, because I actually was just in a national webinar, and I know that they're doing incredible DEI work. As we stated earlier, we are in our infancy. Myself and Janica had our time this week to join the national conversation, and it is definitely a priority. So Andrew, could you build a little bit on that?
Sure. So as mentioned, with those nationally adopted standards of quality, diversity, equity, inclusion is a key component of that. So that's one part of the mix, is ensuring that, and as people are prepared to do this work, that we're focused on diversity, equity, inclusion. Another piece of it is that one of the things that's in the standards that's listed as cited as examples of high quality work are effective parent advisory committees. So we actually have a whole nother training that's specifically on that. Developing and sustaining effective parent advisory committees. And that's particularly important to note because we can't get to equity unless people have agency in their communities. And family resource centers are natural conveners of parents to take responsibility for, take ownership for, and take leadership for their communities, which includes both advising the center as well as engaged in external systems change or advocacy work to address challenges that are facing communities as a whole. So those would be some examples I would cite of this work.
I'd just add to that each center is really locally and community based. And so they oftentimes really start reflecting who they are, and who's on staff there, and that who's on staff and what is really important in this area. So for instance, in our Skagit County Family Resource Center, that community has a very a large number of Hispanic communities that are in there. And so we see a much higher number of employees that are Latinx in our staff than we have in our Whatcom office, which has fewer. So I think our local family resource centers start looking a lot like what their local community is, and they strive to that.
Thank you so much. I'm going to move on to a question that's related to ESJ. The next question is, how are family advocates trained to help families with children with disabilities navigate DDA, SSI, etc.? These families may need support that is not related to low income. The parent-to-parent network in Washington State will be a great state network partner.
I don't know if anyone wants to take that with the Washington State perspective. I can share with the national perspective that in California, in your region there, that California has a whole network of FRCs that are specifically set up to support families of children with disabilities. And those centers, again, are of, by, and for the community served, with the staff, the leadership typically being parents of children with disabilities themselves. And so they have a focused attention specifically on addressing the concerns and opportunities of families. And then I would say that other centers that are not specific to working with those populations, again, would need some familiarity, at least to be able to make referrals to organizations that have more familiarity. So we often talk about FRCs as being inherently collaborative, because while no one FRC could possibly be the expert in every issue and have every resource, it's FRC's responsibility to know where those resources are and help families to be able to connect and navigate to them successfully.
All right, I'll move on to the next question. It seems like sometimes there is a tension between funding the overall infrastructure of an FRC and other staff available for drop-in, family-friendly buildings, community events, and funding specific family supportive services. Do you have any insight from other states about mechanisms and approaches to sustainably funding that overall infrastructure?
So if the questions from others related to other states, I would say that supporting FRCs with flexible funding, general operating funding is the ideal, because there's so many different things that FRCs do. And as mentioned before, what they do is reflective of the community they're working with. So it's going to look different from place to place in terms of the services and supports related to the needs and interests of the community members. So I would say states committing flexible funding to FRCs makes a big big difference. We've also seen great models of funding, such as in San Francisco, California, where the main funder there has kind of a menu of supports that FRCs need to provide these certain things, but there's flexibility in each of those related to the particular community that they're working with. And then there's other things that they may want to do as well that they can use the funding for. So that's part of the mechanism for funding is you want to honor and recognize the importance of the community-driven piece, but at the same time, you also need to standardize certain things that FRCs do. So it needs a thoughtful approach to do well. The good news is there are many states that have already been doing this. So Washington does not have to reinvent the wheel to look at how to do that effectively.
Thank you so much. I'm going to move on to a different line of question here. We have a question requesting to talk more about the role DCYF is playing, particularly with respect to the landscape analysis. Thank you.
So this is Dave. I'll take that one. So we are in active conversations with DCYF, and for those of you who might not be familiar, they did issue a grant earlier this year for a landscape analysis of family resource centers across the state and other community-based organizations. Because one of the things when we started convening here is that we learned that there are a variety of public and private entities who are doing this work, and nobody had a really good understanding of what all those entities are. And so our hope is that with DCYF's landscape analysis, we will have a good sense of what those organizations look like across Washington state, and also where there isn't anything that anybody is aware of. You know, our understanding from the department is that they are very supportive of stabilizing this system and growing this system, because as a number of your questions are pointing out, one of the things that most family resource centers have in common is we are extremely creative at braiding different funding streams to do whatever the work is in that local community. So that's one of the strengths of the CBCs and family resource centers. It's also a challenge. And so when that when the landscape analysis is done in the fall, we will be very interested in partnering with DCYF and in seeing what the outcome of that information is and partnering with them on next steps.
Thank you, Dave, so much. We're going to use a final question to wrap up today's session. And that question is, how can people get involved at the local and at the state level in this work?
So I can get and give my thoughts on that. Certainly could reach out to me in my office, and I can help introduce them to wherever they're located, their family resource center. My district is a 39th district, so I cover from Skycomish, a little small town up on the Cascade Hills, down to Monroe, and then up north all the way to Skagit County. So we have, maybe Byron can help me out, but I'm thinking that we have 6 family resource centers in my district. But you know, I'm going to get a better handle on that number. But certainly any of us that are on this panel can help people get information. They're always looking for volunteers. I know that, because every center does all kinds of activities and events, and a lot of them have a food bank associated and sometimes on their property. I mean, they are, everything that a family needs is located or close to a family resource center. So please reach out. And I certainly would love to have conversation with you if you're interested in getting involved.
Yeah, and I'll just piggyback off of that. I mean, we here in Washington State are in an early developmental stage. And we encourage all that are interested to please provide some type of notification to Janica that you're interested. We want to really incorporate the voices of those that are in those communities, and this is in development. So if you see an opportunity where you'd like to share your insight, please reach out so that we can invite you to further conversations.
All right, if there are no more questions, I'm going to turn it back over to you, Janica.
Yeah, so thank you all. We really appreciate. So I did not introduce myself at the beginning. I'm Janica Lockhart. I'm the Chief Impact Officer at Children's Home Study of Washington. I've been the person behind the scenes today. And I want to also thank Hoban with Children's Home Study of Washington as well, helping out today. As I noted in the chat box, when you all registered today, we collected your email address, and we plan on following up with all the registered and indicated yes, and their answer that they were willing to sign up with our email list on follow-up. We are hopeful that in the fall, we'll begin a full stakeholder engagement process with FRCs, with public-private partners, as well as families, in developing a vision, purpose, and structure of what a statewide family resource center network is, in alignment and support with the National Family Support Network as well. So we just really want to thank you all for attending today. And as I indicated in the chat box, we'll be posting this video up on YouTube and also sharing the slide deck with all that registered. So if you missed anything from any of the presentations, you'll be able to go back and watch those. And so just thank you all for attending. Have a good afternoon.